Hi, this is Dr. Jim Dougal, board certified emergency physician here in Johns Creek, Georgia, with another episode of how we're fighting the coronavirus, not only at Stat Medical Care, but how our community is fighting the coronavirus and the preparations we've done and how it's affecting all of us. And today, we're going to be talking with my good friend, Dr. Malcolm, who's a dentist across, oral surgeon across the way from Stat Medical Care, and how it's affecting him. But what we found so remarkable is we entered his office. We have Dr. Malcolm, Dr. Mox, social distance. We love it. And this is great. This is probably the best we've seen on social distance.
Everybody's got to keep their distance.
That's right. He loves, actually makes it twice as big for me. So Mox, tell me, how has the coronavirus affected your practice and the way you treat patients during this pandemic here in Johns Creek, Georgia?
Well, we basically, I'm an orthodontist, and so we basically have shut the practice pretty much down. We're taking care of emergencies, we're taking care of kids that are in pain, people that have appliances that are twisted or broken and need to be adjusted. So very, very few people coming in for us to take care of. But when they come in, we have everybody wash their hands before they touch anything. We have a sign on the door that explains that if you're coughing, have a fever, if you've traveled out of the country in the last 14 days, or if anybody in your house has COVID-19, that we'd rather you not enter the building at all, just reschedule. Maybe get over and see Dr. Dougal here, let him help you. And so we're basically limiting the number of people that we see. Everybody's keeping their social distance. We've taken magazines out of the waiting room. We've removed a lot of the chairs out of the waiting room, so anybody that sits in the waiting room pretty much has to stay 6 feet apart. And then we disinfect the office 3 times a day, morning, noon, and before we leave in the evening, so that we're trying to do our part to keep everybody safe that comes in here, and the staff will be safe that's working too. But for right now, and according to Governor Kemp, we're going to be pretty well on lockdown at least for the next 14 days, and it looks like maybe till the end of the month.
Mark, how has your staff felt on your preparations, and how have they felt about their families and the community? Have they felt, I'm sure they feel fear and nervousness, but yeah. Tell me, what have you gleaned from the staff?
I think that the staff is okay with the idea of working again as long as they feel like we and the patients are trying to control as much as we can about everything about the virus. So I think that, but there is I think everybody has a fear, and I use the word hysteria. It's just on different levels about what to do. Everybody wants to do the right thing. We want to protect the staff, the families, and the patients, and the patients' families. So, it's I think that it's they want to come in to help people, but they also understand why we have to close right now, why they can't be here. And but I think it's a confusing time for a lot of people.
In your family, I know you worry about your family. You don't want to bring anything home to them. I'm sure you go home and take your clothes off and shower in bed immediately, which is what we've told most doctors and people to do immediately. But you have your daughter is a neurologist.
Correct.
Have you talked to her? How do you feel? How does she feel? Has she talked to you about this and
yes.
About is she safe and given you any good feelings or bad feelings?
Well, she is using the telemed system quite a bit, and so she's able to do a lot of her follow-up treatments, not treatments, but follow-up exams and discussions with her patients using the telemed. However, she is in a hospital. She works in a hospital, and they have basically brought people in, all the doctors and nurses, and said we need everybody available. And so, even though she's a specialist, they are basically calling everybody internal medicine doctors now, so that anybody can be called into work, because some of the doctors and nurses have actually become infected in the hospital that she works in up in Pennsylvania. And as most people know, New York has been the epicenter, but Philadelphia's got quite a problem as well. And so her hospital has a lot of cases going on, and she understands the necessity for protection, and she is on the front lines and sees it and sees the number of people that are in the hospital, and so she is well aware that there's quite a problem, and and that's why we have to do all these precautions, and why we do need to stay inside and honor what Governor Kemp is asking us to do.
All right, you're gonna speak to your patients. What do you want to tell them how to stay safe, or what would you like them to really concentrate on besides social distances and?
Well, I think actually the fellow that I heard, Dr. Dougal, went to Cornell, and so there was a doctor that was on TV late one night, but he went to Cornell as well. That's why there's a connection there. But he was explaining that the best thing that we can do, social distancing, absolutely, try to stay out of any kind of large groups. But he said the best thing you can do is wash your hands, keep your hands away from your face. He said if you're touching your eyes, you're touching your nose, you're touching your mouth, that's how you're introducing that virus into your body. And so wash your hands so that if you do accidentally touch your mouth, nose, or eyes, that you're keeping the virus away. But honor that social distance. Try to not associate. Certainly, if anybody's sick or they have a fever, stay away from them and their house. And really, as hard as it is important to isolate and honor those wishes.
All right. Well, finally, that's great advice, and how people have even the simplest things are important: distance and washing your hands. And if you're looking for an orthodontist, Dr. Macamel is on 141 and near Ventana and on Medlock Crossing here in Johns Creek, Georgia. We want to thank him very much for taking the time to speak with us today. And this is what our videos are doing, is giving you the life in Johns Creek, also not just at Step Medical Care, but all over the community with EMS, with the clergy and store owners, to actually see how they're affected by this pandemic. We'll see you next time. As Dr. Macamil said. Oh, sure, Dr. Macamil.
One other question. I want to get Dr. Dougal to say this on the video, because the question that I get a lot is, how should I behave when I'm in the grocery store? And because that's the one place where it all seems to be going, right. And we need to get our things that we need, so food, toilet paper, cereal and milk. But what should I be telling people about how they should behave in a grocery store? That's what I would like you to tell.
Well, this is great. It was a great question. We actually did a video on this. If you want to look back at our videos, and our suggestion was, that's the hole that the governor needs to plug, because the people in the stores, the food stores, don't have any protection. I mean, they're not using gloves or masks. Now, some of the stores put up a plastic separator between the person who's doing your bags, etc., and doing your bill, and that's got to be re-looked at. But what Dr. Macamil is asking, what does it do if you're shopping at the store? I would wear gloves. I mean, they are cleaning the carts for you, but it's not enough. If you need something in an aisle and you see 2 or 3 people in the aisle, it's time to shop elsewhere and pick up what you want to in a different aisle. Check the aisle before you go down. If the aisle seems to be 2 people in the aisle or 3, and it's a long aisle, there's time. The people are going to move out the aisle, use the next open aisle, shop and pick up whatever you need, and return later. In the meat department, the same way. If you don't see something and you have to talk to the person who cuts the meat, what you want to do is you want to come back. You don't wait. Come back and then pick it up, because standing there, even the distance, there's other things you can be doing. Produce also. Make sure you wash everything. And
what should they wash things in? Is it just soap and water?
Cold water, soap and water are great. Cold doesn't mean it could be hot or cold. It's not important. Just washing is very important. And take care, always wash your hands. After you leave, wash your hands, or do a wipe in your car. Make sure you wipe down your steering wheel. Make sure you wipe down the gear shift, if you have one. Wipe down the areas in your car, and then when you go home, before you do anything, wash your hands again. You have to constantly wash your hands. And this will help tremendously. If you have a mask, you can use the mask. It's okay to use a mask. Don't feel odd using it. but keep the distance is important. Wait till the aisle's clear and come back down the aisle.
Great advice.
I hope that helps a little bit.
Absolutely.
Hope it helps
So-
out. All right, again, I know this has been a long video. It's been great questions. Thank you very much. We will be back with you again for our next video on the community here in Johns Creek. And thank you very much for tuning in. And thank you very much for liking at Stat Medical Care on Facebook or on YouTube. All right, wash your hands. Don't touch your face. Thank you very much.